Well, kia ora koutou katoa. Welcome again to Manatū Hauora. I hope you had a sunny and safe trip up the road here to the update on the Omicron outbreak response. Thank you very much for coming today. I am joined today by Dr Joe Bourne, who heads the primary care aspect of our health system response to Omicron. Joe is there on the screen. He's going to not be there while I'm talking because we've got the signer here, but he will make some comments when I've finished, and then we'll open up for questions. I will start with an outline of the latest situation, and all the detail will be in our 1 p.m. statement as usual. So today we're reporting 23,183 new cases of COVID, with 503 people in hospital, of whom 7 are in intensive care, and we have a total of 146,527 active community cases across the motu. Of those cases we're reporting today, about 85% are people who have self-reported a positive rapid antigen test, and the balance are PCR tests. So our cases continue to rise rapidly, and for the period from the 21st to the 27th of February, about just over 1% of the New Zealand population were active COVID cases. We're continuing to see a large proportion of our current cases are under 30 years of age, and of the cases announced today, 54% are under 30 years of age, with just 14% over 50. The opposite pattern is seen for those who are in hospital with Covid-19. Of the 345 people in hospital in the northern region, where we have the best data, and those who are not in ED there, so these are ones who are on wards, just 21% are under 50, while around 60%, are under 30, while around 60% are over age 50. In terms of our hospitalisation rate, the way we're calculating this at the moment is the number of people in hospital over the number of current cases, which are those people who have been diagnosed in the last 21 days. And at the moment, that rate is just 3.5 per 1,000 active cases. However, as we've seen in other countries, hospitalisations lag a week to 10 days behind case numbers, so we're expecting both the numbers and the rate to increase over the next couple of weeks. And as of 2 p.m. yesterday, 11% of the total number of people in hospitals in the Auckland region were there with COVID. So about 1 in 10 people in hospital, and that includes those who are in the emergency departments. Now, as you know, vaccination remains the best protection against hospitalisation, and the hospitalisation rate for people 12 and over who have had a booster is only a fifth of the rate for those who've not had any vaccinations. And yesterday, in terms of booster doses, nearly 18,000 were administered across the country. But there are still 938,000 people who have not had their booster and who are eligible. That's about 28% of those eligible. So I would encourage those who haven't had their booster dose, and it's 3 months since their last dose, to please go out and do so. It will protect you, your whānau, and of course, those in our wider community. It's great to see our vaccination rates for 5 to 11, or numbers still continuing to increase, with around 51% of 5 to 11s now having had that first dose. Rapid antigen tests are being taken up around the country by people who have symptoms or are household contacts, and through our critical worker exemption scheme. They continue to arrive in the country on an almost daily basis. Yesterday, a further 3.6 million rapid antigen tests arrived, and there are just over 100 million on order between now and the end of March. Another 3.5 million have been sent out to our DHBs today, and yesterday we had 1.3 million distributed out to our primary health organisations to go out into general practices. So the new rapid antigen tests are flowing out through the supply chains. You will all be aware those supply chains are challenged, with many people who work in those supply chains, either cases or contacts. At the moment, we've got 169 collection sites. Those are the places where people who are on that critical worker exemption scheme can pick up rapid antigen tests. So 169 of those across the country, over 100 community testing centres, as well as 26 other providers that are focused on our Māori and Pacifica populations. And of course, general practices also and pharmacies are able to use rapid antigen test, and it's great progress thanks to all involved. I do want to just make a point that GPs are not collection points for rapid antigen tests. If you need to be assessed because you are unwell, you should make an appointment with a GP, and they will determine which test you might need. That could be a PCR test, a supervised rapid antigen test, or they may give you rapid antigen tests to take home for you and your whānau. Those other collection sites are the place where you can go to collect rapid antigen tests. And we've enabled a new technology to assist this. It's called our RATS requester site. So people who are symptomatic or are household contacts. This initially went live on Tuesday. It had a few bumps yesterday. Those have been sorted out. And more than 65,000 orders have been placed online already, and 1,000 orders over the phone. So you can think of that like a click and collect. You can pre-order your rapid antigen tests and then go to one of those collection points rather than having to turn up and queue perhaps at a community testing centre. And finally, just with the high numbers of COVID cases around the country, it's inevitable that our health workforce is impacted, and a number of them are either cases or household contacts or caring for cases. So the volume of work fluctuates on a daily basis, and this is particularly an issue during winter, so our facilities are used to dealing with it. They manage staffing through the day to ensure essential services continue to be available for everybody. Our health services across the country, including in Tamaki Makaurau, where most pressure is on, are managing to provide care safely for anyone who needs it. So I do want to acknowledge and thank our healthcare workforce who are responding extremely well to this rapidly increasing Omicron outbreak, as they have right through the pandemic, continue to keep New Zealanders safe in what is a very challenging time. Kia kaha. Hoi anō ka nui tīnā. So I'm going to hand over to Dr. Joe Bourne, who's joining us on the screen. He's got some comments to make, and then I'd love to open it up for questions. Over to you, Joe.
Kia ora koutou. I just want to start by acknowledging the enormous amount of work that's already taking place in our communities by community healthcare providers and others. And this includes iwi, Māori and Pacifica providers, general practice, pharmacy, telehealth, ambulance services and others. And the length of that list just demonstrates the collaboration that's needed at this point of the COVID outbreak in order to be able to meet the needs of our communities. I also want to acknowledge that all of those people working in that sector have been dealing with a huge amount of change during the last 2 years and throughout the pandemic. And that is tiring. And when we now find ourselves in a situation where we're getting large numbers of cases, that can feel like an uncomfortable place to be in. So what we're doing through the Ministry of Health and through our district health boards is providing as much support as we can to enable them to continue to work and provide the services that people require. The number of cases that we do have now require a whole of system approach. And so in order for us to be able to work effectively together and making the best use of our resources, we need good collaboration between all of those providers and the assistance of our communities to support themselves as much as possible when they're able to. As you've been seeing in the figures to date, over 99% of people with COVID are being safely cared for and isolating in the community. In my experience of working, the majority of people who are catching COVID are able to care for themselves with support of their whānau and with others in their community. The Omicron variant, especially in those people who are fully vaccinated and particularly in those who've had a booster, is a mild to moderate illness at worst. And because of the work that we've done over the last 2 years and because of this particular variant, it is more similar to a cold or the flu. And most people will be able to perfectly manage that themselves. I've been talking to one of our telehealth providers today, and they're describing the need for people to have an Omicron first aid kit. And that really comprises of things like paracetamol, if you've got a high fever or feeling any pain, throat lozenges, if you've got a sore throat, and also emphasising the importance for people to make sure they keep themselves really hydrated, so drinking plenty of water. Information on how you can look after yourself is available online, and we'd really like to encourage those who are able to access information online to do so, because we also know that for a number of people accessing information online isn't as easy, and therefore we need to save our general practice services and our telehealth providers for those who can't use those types of resources. It's brilliant to see how communities are gathering around and supporting each other. Networks of neighbours who are setting up groups so that they can inform each other if and when somebody tests positive, and then they can help by getting shopping and other things that people need. So by doing that, and by communities supporting themselves, we can save our healthcare resources for those who are at greatest risk of serious illness associated with COVID. So that's people who are pregnant, people who are living with disabilities, or people with long-term conditions, and also acknowledging that the importance that we reach out to our priority populations like Māori and Pacifica, who have particular needs during this time. General practice is working really hard to proactively identify those people who are at higher risk. It's worth noting that on a usual day in general practice, they will be seeing 50,000 people. There'll be that many contacts in a day, which is a huge number of contacts. But when we look at the number of cases that we're getting now, and over 20,000 cases a day, if all of those cases present to general practice, it just creates a workload that is too much, particularly acknowledging that our primary care providers will also have staff who will catch COVID and will need to isolate in order to look after themselves, but also to protect their communities. So whilst general practice will continue to be able to meet need when it's there, they won't be able to call every single person that has COVID, and therefore, if people are feeling particularly unwell, view the resources that are online, but also reach out for help. Don't wait to be contacted. It's also worth acknowledging that some of the less urgent work that would normally occur in general practice may need to be postponed, particularly while we go through our current surge of cases. What we'd ask people to do as much as possible is, where you are able to use the digital tools that are available, please do so. We acknowledge that at times, the waiting times to get through to some of our telehealth services can get quite long. And so if you can support yourself and provide information through the online services, that's incredibly helpful. And an example of that is it is possible to report a positive rapid antigen test through the My COVID app. And so really encourage people to do that. When you've been diagnosed with COVID, you will be sent a text message that provides a link to an online assessment form. If you can take the time to complete that, that provides information to our local care coordination hubs, and they're able to then quickly identify what any needs that you have may be, and they don't have to follow up with more phone calls to try and make contact and make sure people are safe. So all of those actions really do help the system to work effectively. Our digital teams have built a number of systems throughout COVID which have helped us to manage the scale of the challenge that we've got. And we have built systems that are supporting providers to work collaboratively together. I'd like to acknowledge that at this point, those systems aren't perfect, but our teams have demonstrated an ability to learn and to respond to the needs of our providers. And as we've seen with applications like the COVID Tracer app, they can deliver rapid improvements so that those systems will be important for us to work at the scale that we need to work, and they will be constantly improved, but also noting that as general practice and other primary care providers are adapting to these new systems, there can be some challenges with doing so. So we will continue to support people to make that as easy as possible. The health system in every country has been put under stress whenever they've had a surge of cases, but the situation that we're in has really benefited from the time that we have gained for when we're getting this large number of cases. So I'm confident that we have a community provider network that will be able to provide the care that people need when they need it. I'd just like to finally acknowledge again that it's really humbling to see our community providers once again rise to the challenge that we've got now and have huge confidence in their ability to continue to provide New Zealanders with what they need at this time. Thank you.
Thanks, Joe. To talk with that. So happy to take questions.
Dr. Bloomfield, are you confident a majority of people are registering their rapid antigen test results through the system when testing positive for COVID?
Well, it's very hard for us to know that. So saying we've got over 20,000 cases today, the vast majority, 85% of which are from people registering those rapid antigen tests. So my sense is if people are motivated enough to go out and pick up a rapid antigen test, then they will generally be motivated to record that result.
How accurate do you think our daily case numbers are at the moment? Could they be much higher than they are?
They could be, except we've got these other indicators, including our hospitalisation rate, and also, as part of that, the number of people who are turning up in emergency departments, having not been tested, but turning up unwell. And we've seen that in every outbreak that we've had previously, and the proportion of people doing that does not seem to be unduly high. So I think if you put all the indicators together, I think we've got a quite good picture of the actual number of cases that are out there in the community, and we continue to do some work to see if we can estimate what the total burden could be at any one time.
On those hospitalisations, what percentage of people either being hospitalised or being to hospital are unvaccinated?
Well, a small proportion, given we've got a very high vaccination rate, except to say that the rate of hospitalisation is 5 times higher for unvaccinated people compared with people who have had their booster dose of the Pfizer vaccine.
Are you aware that clinical workers are waiting more than an hour to get their RAT tests and sometimes going to other sites because of the lines at these collection sites?
Yes, I'm aware that there have been delays in some places intermittently, and I understand there's quite a delay at the collection site in Christchurch today, and our team's on the phone and working with the DHB there. You will see that every day we are opening up more and more of these collection points to help with this issue where some people are having to wait. It is intermittent, and I think for most people they're getting both able to order ahead now and pick up their tests quite smoothly.
Are there any more contingency plans in the works for this?
The DHBs will continue to open up collection points, and of course, with both the community testing centres and the collection points able to provide the tests to people now, I think we're seeing plenty of tests being given out and an increase in access points every day.
Do you have any advice to Kiwis and critical workers, maybe in particular, on the best times to try and get them, or anything that can ease that process up with some of the digital technology that you've talked about today?
Well, certainly if you use the online order form, the RATS requester, then that will point you to where you can go to pick up your tests. Likewise, on HealthPoint, we're constantly updating the places where people can go so they can find out there might be more than one place near them that they can collect. The only other advice I would give, and it's a request really, is that people just be patient. I know that a number of the staff working at these sites have actually been subjected to some quite unpleasant behaviour. And of course, it doesn't make them want to turn up to actually do that. And so I just encourage people, as they have right through, please be patient. The staff are doing their absolute best. And as I said, there will be more sites opening up every day across the Motu.
You said earlier that the peak of hospitalisation is probably going to be over the next couple of weeks. But in terms of case numbers, are we now getting close to the peak of daily case numbers?
I would say that the peak of case numbers will be over the next week or two. And then the hospitalizations are likely to peak about up to 2 weeks after that. So the modelling at the moment is suggesting middle of March for the peak in cases, and then perhaps that last week in March for hospitalizations. Yep.
Some of the generic instructions given out with the rats actually contradict the manufacturer's advice. One says you'll need to read it visually and should use a device that's not actually available in this country. Should they not be specific to that test?
So there are different test types. We've got actually 11 types of test available now in New Zealand. Not all of those are the self-administered ones, and they come in different size packs as well. So you're correct, the advice that's given out and that's on the website is general and tries to cover as many as possible of the tests, but people should follow the specific instructions for the test they are actually given. Depending on which ones have come in through our arrivals in the last few days, it may be that people are being given different ones in different places. So ultimately they should follow the instructions that is on the packet of the one they receive.
Is there any benefit in reporting negative rats?
Not particularly, no. We don't see any benefit. And there are two reasons for that. One is that there will be a large number of them. Secondly, and I think this may be the experience of people you may be aware of, is that sometimes people can return 1, 2, even more negative tests before returning a positive test. So what we're really interested in is if people are symptomatic and remaining symptomatic, that they do keep doing those tests, because usually there will be a point in time during the illness when the test will become positive. I'll just come to Mark here.
What's the logic in not putting a prevalence survey out into the field now? What's the harm in having more data? Is it just a matter of not having the resources to do that?
Are you talking about a symptom prevalence study or a seroprevalence study? A symptom prevalence study. Well, if I can be honest, Mark, to plan and deliver a study is quite an undertaking. And so my sense is that the data we're getting from case numbers, hospitalizations, and of course we will be doing some modelling around that, and our wastewater testing will give us a picture of what the likely burden is through this Omicron outbreak. And then the real value will be in perhaps a little further down the track doing a survey which will ask people about whether they've had symptoms and or had a positive test, and do certainly for a subset of those to do a seroprevalence survey as well. Yep. So go down the back.
At the moment we are seeing a large proportion of our cases in that younger age group. Can you please share with us the gist of the COVID vaccine technical advisory group's advice on why we are not boosting that 12 to 17-year-old age group at this point?
Yes, so I've had advice on this. It's gone through to ministers. The advice of the group at the moment is that the balance of risks and benefits is there for, and you see a number of other countries do this, is there for 16 and 17-year-olds, but that they don't think there is sufficient evidence at this point to routinely offer a booster to 12 to 15-year-olds. Other than on the advice of a clinician who looks after them if they've got an immunocompromise, a disease that compromises their immunity. So that advice I've received, we're turning that into advice for ministers, and then working out the operational follow-up of how to put that into action. I don't have an update yet on when that will come into effect, but we will let people know. I know there are 16 and 17-year-olds and parents of them who are interested in this and would take up that opportunity. So that's the advice at the moment, and it's quite consistent with what a number of other countries are doing.
What is your
Sorry, follow up.
Sorry, so it's with the minister at the moment.
I'll come back to you and check. It may be sitting with me, and the team is off the back of that advice writing a paper for the minister, but we'll come back and just let you know and give you an indication of timing. But generally, I would imagine there'll be an announcement about this in the next week or so.
What is your reaction?
I'll just come in.
Some people may be thinking because Omicron is widespread and it can be managed at home, that there's not really any point in declaring a positive rat test. Can you just outline why it's important that people do still register that?
So there are two reasons why it's important. First of all, it helps us understand the burden of illness out there, and that's very important for our health services to be able to plan and be prepared. And also the distribution around the country is very important. for us to know kind of what's coming if there's a wave. But the second thing, of course, is in registering their positive result, people are then able to also identify who their contacts are. And there's a real opportunity to let people know who are your close contacts that you've returned a positive result, because then they may take specific precautions around who they do or don't visit. They will need to let their employer know, and if they're a critical worker, they can then they may then use the rapid antigen testing to help enable a safe return to work.
What is
Do
your
you
reaction?
do you have any figures just around how many of these cases and hospitalisations are made up of Māori?
Yes, we do have those data, and we'll provide them to you afterwards. Yeah, we've got them for both the cases in the last day, the cases in the last 2 weeks, and also those who are currently in hospital. Yes, we can provide those.
What is your reaction or thoughts on the allied health workers strike taking place tonight?
Well, of course, a strike in the middle of a significant Omicron response would be disruptive, and I guess the concern that the district health boards would have, and I would share, is that it could compromise care for some people. However, I know that the Employment Relations Authority is considering this issue right at this time, so I'm not going to make any further comment on it.
And with Parliament's occupation essentially over now, do you have any concerns about positive COVID-19 protesters taking COVID to their home or to their town?
Well, I think everyone would have concerns about that, and I guess those people who were at the protest who may be unwell, I would invite them, as we do all New Zealanders, to take that seriously, to look after others, and that includes following actually the requirements on them if they are a case, to isolate for 10 days. That's actually a legal requirement. So if they're unwell, they should get a test to look out, so make sure that they get the care they need and support they need, and that they can protect those around them as well.
The ministry has acknowledged that rising case numbers and multiple concurrent changes to IT systems have resulted in delays in notifying some cases. How concerning is this, and what's your best estimate on how many patients this might be affecting?
So I'm going to hand over to Joe to comment on this, and what I would say is I don't think we'd have an estimate of how many people it would be affecting. But Joe, did you just want to comment on the what's behind some of those delays and the work that's going on to improve that?
Yes, I mean, clearly now when people are using rapid antigen tests, they're informed of their diagnosis straight away because they've got the benefit of seeing that test. Some of the issues that we're working through at the moment just relate to the fact that information is being passed through multiple platforms. And many of these platforms are ones that have been developed over most of the last couple of years, and sometimes much quicker than that. So as with launching any new complex technology across multiple platforms, there will always be teething troubles with the speed with which information is communicated from one to another. So our digital teams are meeting several times a day. We're getting really good feedback from the healthcare sector whenever issues arise, and they're problem solving as fast as they can.
Yeah. So the main delay that's been experienced has been the transfer of the rapid antigen test result when people upload it to My COVID Record across to our Care in the Community module. And the team have been putting in improvements every night, actually. There's another one going in tonight. But I do want to go back to the comment that Dr. Bourne made earlier on. If people are feeling very unwell and want to seek advice, then they should do so, whether they have heard or not. Are there any other final questions there?
As we go into autumn and winter, there's other viruses floating around. We have less restrictions this autumn compared to last year. I guess, are you expecting that to increase the amount of demand there is for testing, because people are going to be presenting not just with COVID symptoms, but other virus symptoms as well?
Yes, correct. And with the border reopening, we will see other viruses, and almost certainly by the middle of the year, we'll have influenza back across our borders. That's why we'll be rolling out an even wider flu vaccination program than we have in the past, with a wider group of people eligible for free vaccination. Some of the things that we've learnt are very helpful in protecting us during COVID will also apply to influenza and indeed the common cold. So use of masks, very helpful. physical distancing, but most importantly, and I hope this is a behaviour that New Zealanders will take on board for the future, is staying at home if you're unwell. We now are used to being able to communicate and, if we're not too unwell, to continue to work from home. So I think all these things will actually help us through this winter and remain important. But we are certainly well aware, not just of sort of colds and influenza, but also other things like measles that could come back across the border. So again, people should make sure if they haven't had, or if their children are not up to date on their measles vaccinations, they should do that.
Are you planning though for, I guess, an increased demand in testing? Because people are going to be showing up with more symptoms that look like COVID?
Yes, so more, as we call ILI, influenza-like illnesses. Possibly. What I would say is, of course, we don't usually test people who present, who either call Helpline or present to general practice or to hospital for influenza-like illnesses. And I think by the time we get to that point where our influenza season starts, we will be in yet another sort of phase of our response to the pandemic. And quite what the role of testing will be in that phase, I think, is yet to be determined.
Dr. Bloomfield, we're hearing from pharmacies that they weren't aware that they were going to be collection sites until they heard about it in the news. And so they're getting multiple calls about this, and they're being paid about 50 cents per rat to do that service. Can pharmacies opt out of this? Were you aware that they weren't notified previously by the Ministry of Health on this?
So to date, our pharmacies have been doing not all, but many pharmacies have been doing the supervised rapid antigen tests for people who need it for domestic travel purposes or for supporting a court matter. And there were discussions with pharmacy, and again, not all pharmacies will be required to, so it's an opt-in to if they do want to be a collection point for rapid antigen tests. Now, general practice has found the same issue, and whilst we've been at pains right from the start to say general practices do not have rapid antigen tests to hand out, people are used to going to pharmacies or general practices for care, and so they have assumed that they were available. So I think just the point here is, if people do need rapid antigen tests, either a community testing centre or going to a collection point, having used the click and collect, the online RAT ordering process is the way to go.
So you just on this, the pharmacy says that they've been noted as being one, but they weren't notified of that. Are you aware of any of those cases?
I understand that the pharmacy, we had been talking with pharmacy sector representatives, but individual pharmacies may not have been aware or had an expectation that they would be a rapid antigen test distribution point.
Can they opt out?
Yes, they can. So they don't have to, they're not obliged to provide rapid antigen tests. So saying many pharmacies are already retailing rapid antigen tests. So many are choosing to both retail and to be providers of the publicly funded rapid antigen tests.
You've seen some modelling on when we'll reach our peak of community cases. What was that number of our peak?
Well, actually, the number in some of the most recent modelling was below the case number we're seeing at the moment, because what the modelling does is it has a low, a middle, and a sort of high forecast. At the moment, we're more on that high forecast, and of course what they can do now is update it as the numbers come through every day. So the modelling at the moment on the high forecast does show us hitting a peak in the next week or two, but I can't remember the exact number that is on that. And one of the things I would say is that the use of rapid antigen tests and the capture of the number of cases we are getting has meant that the numbers have gone up more steeply and to a higher level than some of the early modelling suggested. So they'll be adjusting that now to just give us a new estimate of what the peak might be. We can share what that peak number might be.
How many of the current cases are Delta? How many are Omicron? What's your best estimate?
So I did see some data yesterday, and I think we were circulating that around, which was of actually only a proportion of our hospitalised patients from probably a couple of weeks ago. And at that point, if I recall, it was about 30 or 40% were Delta and the balance were Omicron. We're updating that at the moment, and one of the things we're having to ensure is that all the samples for people who are hospitalised who receive a PCR test, that those will go to ESR, and that hasn't been happening to date from all the laboratories. So what we'll do after this is give you an estimate of when we'll be able to provide an updated estimate of, I'll give you a date for when we can provide an updated estimate of what the balance is.
Is there anyone in New Zealand who had earlier COVID-19 strain who's now known to have caught the Omicron strain as well?
Not that I've heard of, but I imagine that when it does happen, there will be a story about it. So we're likely to hear about it.
Are you
Yeah.
genome sequencing beyond hospitalised cases?
Yes, we're genome sequencing people who arrive in New Zealand, return a positive rapid antigen test. They then have to have a PCR test, and those will also be sequenced to help with our sort of border surveillance around variants.
Do you have any advice from modelists about the likely impact of that change to isolation rules with non-household close contacts? Because they would have been building their models with the assumption that those people would have to isolate and have it out.
I suspect they're building it into their models now, and likewise the drop from 14 to 10 days that happened with the move to phase 3. But I'd have to just go back and look at the modelling. I can't remember off the top of my head if that's been built in. Are there any other final questions?
After the Omicron peaks, how likely is it that Delta will continue to exist in the country and have flare-ups? I mean, or do you think that Omicron will just basically render Delta non-existent?
I have to say I don't know. We'll all be watching that with interest. Certainly if we look at countries that have had big Omicron outbreaks ahead of us, and I look to Denmark because they do so much testing. Virtually all of their tests are of and whole genome sequencing is of Omicron. So it effectively displaces Delta because it's just so much more transmissible. Okay, thanks very much. I really appreciate you coming up. Have a good day. Thanks, Joe.